As you know, if you don't know, there was a threatened closure back in around 2008. Again, back then, the community came together with the elected officials, and we want to thank them who participated in saving the hospital back then, but we need your help again. Today at 1:30, we started our summit regarding the MetroSouth issue, the closure, different ideas from the first responders, local community leaders, and people who work in staffing in the medical field. We heard the pros and cons of how this would affect them, how it would affect not only Blue Island, but the Southland, and it's a national issue. And some of the comments were here that we might have to be innovative here, that this hospital has been innovative in the past, and maybe we're going to be the leader as to a new type of form of hospitals, whether it's multiple issues, multiple departments, whether it's senior care, outpatient, inpatient, emergency room, etc. So we're going to be innovative. And as I stated to the public just a few minutes ago, we need everybody's help. Our state reps mentioned that. Whoever you are, from left, right, east, or west, we all have to come together, and whether you live in Blue Island or not, to save this hospital, because it's very vital to save lives.
We get a lot of different feedback, a lot of people asking questions. It's good to bring people together and get everybody on the same page for a common goal, and the goal is to keep this hospital open. And in terms of it, if it's closure, the impacts of what could be devastating to the city of Blue Island, along with the surrounding communities, whether it's our first responders or just healthcare in general.
Our breakout session was the medical profession group, and we concentrated on the impact this is going to have on the surrounding hospitals in regards to the surge that it's going to cause, and our patients, and the delay time that it's going to take for them to actually be able to be seen by a medical profession.
So when we look out at our neighbors, so let's talk about our most close neighbor, and that would be Ingalls, 12 minutes away. Our emergency department at MetroSouth has 27 beds, servicing nearly 50,000 patients. Ingalls has 30 beds, 3 more. So you don't have to be a mathematician or understand emergency medicine to understand that there is no way that 50,000 patients can possibly be squeezed through 3 extra beds.
Our main focus was on how it's going to impact neighboring departments, not only the city of Blue Island, which will directly affect, but the neighboring departments, and the toll it's going to put on us, taxing our resources as far as increased travel times, the wear and tear on the equipment, and staffing levels for other emergencies, and how we're going to be able to, or we're going to need to be able to rely on one another even more so than we already do. But it's going to definitely be taxing our resources. So that was the gist of it. We had Chief Kevin Welsh from the Glenwood Fire Department who had gone through this with the closing of St. James in Chicago Heights about 2 years ago. So he was pretty instrumental and had a lot of good ideas as to how we should proceed going forward with all of this. So the next step will be a meeting with all the chiefs that are involved in the South Suburban Mayors Association, which would encompass most of MABUS 22, our division, and MABUS 24 to the south here, to try and get a plan as to what we're going to be doing next as a group.
We are not going to allow this hospital to close. We know there's negotiations, but we got to continue assuming that doesn't go forward, that we have other plans, and we'll continue working on that and other ideas. We need everybody to come out on the 24th. What date?
24.
Of what month?
July.
At what time?
10 o'clock.
Social media. What did I say about social media?
Flooded.
Flooded.
So July 24th is part of a public hearing at the Health Facilities Planning Board. They have to hold at least one public hearing. We're going to be holding it at the St. Benedict Church, which is right there close in proximity to the hospital, so the employees could come, community members could come, doctors, anyone that has an impact. Residents of the city of Blue Island should come and just state their personal story or what it means, what this hospital means. So it'll all go into a transcript and get relayed to the board, because ultimately the Health Facilities Planning Board is the one that will vote on whether it give more time before its closure or vote to have it closed now.
We need to gather all that information, all these petitions, and all this together so that it can be presented to the Health Facilities Planning Board, so to show the impact.
We have petitions for people to sign or people to distribute at my office. I could contact my office at 708-396-2822, or send an email to robertbobrita@aol.com. You can contact us, and we also are keeping a list of those who want to speak so that we could keep it in a fashion so everybody don't show up at the same time, so we could spread it out and try to accommodate whether they're coming on lunch or after work or before work. Again, they could contact my office. The number is 708-396-2822, or by email, robertbobrita@aol.com.